very much. Now we're joined by pharmacist Ann-Marie Horan, who is going to answer all your questions. But first of all, before we get to an awful lot of questions that are coming in to us today, I want to talk a little bit about generic and branded drugs.
Okay.
Because there is a big difference in price, isn't there?
Yeah, there is. There can be a 20 to 30% difference, and it's exactly the same drug. And a lot of the generics are actually manufactured in Ireland. So it's another reason to go in and ask your pharmacist for a cheaper brand and an Irish brand.
Okay, now we're going to take a look at difference. First of all, we're going to take a look at ibuprofen, and this is like a painkiller and an anti-inflammatory
Exactly, yeah.
Okay, so we have two examples. Now, we have many examples, of course. We're just going to look at two. For example, Nurofen, which we're all very familiar with, and then just the regular ibuprofen. Tell us how much they are.
Well, the Nurofen tablet is 22 cents, and the cheapest generic, and this would vary between different pharmacies, is 14 cents.
Okay, now we're looking at them because the pack's difference in size. So one tablet of the Nurofen is 22 compared to 14 for the generic, the non-brand. That's nearly half price, really.
And, you know,
they're the same thing.
The generic is manufactured in Ireland.
Okay. Now, I've noticed sometimes that, say, for example, Nurofen, it's a coated tablet, easier to swallow. Maybe that's not the case in the other one?
It is an easy-to-swallow coated tablets, but yes, I mean, the inactive ingredients can be different. So some people might find a bit of a difference there, but, you know, the difference is normally very minimal.
They do the same thing?
Yeah, they do the same thing.
Okay, let's take a look at antihistamines next. And a lot of people coming in now, of course, once the weather starts getting better, people will get hay fever and all that. So we're going to take a look at a well-known brand there, Zyrtec.
Yep.
That is a brand that we all know when it comes to antihistamines. And then this pink one here beside that, that's the cheapest one.
So we go down
from called Histec, is it?
Yes, we go down from 76 cents to 55 cents.
Again,
so good
a
saving
big
there.
difference.
Yeah, exactly.
That's
and again,
tablet.
Histec is Irish made.
And the same amount of active ingredient.
The same amount of active ingredient, yes.
Okay. And the final one we're going to look at is cold sores. So we have a brand there, Zovirax, and a lot of people will know that as using Zovirax. And then the cheaper brand on the other side of that, and that's called Viraleaf. What is the difference in price between those two?
There's about a €3 difference in price between those two. And again, the Viraleaf is Irish made.
Okay, and the Zovirax is over a tenner.
Yeah.
And the Viraleaf Irish made product is only $7.40. And they are the same, and they do the same job.
They're exactly the same. They will both do the same thing.
Okay, well, it's about time, because for years I remember, you know, going abroad and buying, you know, this type of thing overseas, and the difference being so massive.
Absolutely.
You know?
So, you know, the people just have to come in, ask the pharmacist for the cheapest Irish-made brand.
So you come in and you say, I want the generic brand. That's
I want the generic brand, absolutely.
Okay. All right, let us get on to some of our questions from our viewers. And on the phone we have Caroline in Waterford. Hi, Caroline.
Hi, Maura.
How are you?
Good, thank you.
Good. Now, what's your question?
Maura, hi, Anne-Marie. I have been diagnosed with candida, the yeast overgrowth, and I've been on mycostin and diflucan, and I'm being referred to a nutritionist next week. And I was just wondering if Anne-Marie had anything that maybe I could take, because everything seems to be in yeast in your diet, or, you know, is there just anything that could help?
Anything natural, is it you're looking for?
Anything natural,
okay.
Yeah.
Okay, great. Good question.
So you're kind of looking for a supplement, Caroline?
So, yes, yeah.
You could take some acidophilus. That helps, you know, give the natural bacteria back into your body and fights against the yeast. Live yogurt is another thing that you can do in your diet.
Okay.
If you go into your pharmacist, they have a consultation room, and they'll go through your diet with you if you want a kind of more detailed answer.
Okay.
And Caroline, that's free, and a lot of people, we've actually been saying this on the show for the last few weeks, you can go into the pharmacist now, as Anne-Marie says there, and you can actually get all this for free. You can sit down in the room with them and they'll give you all this information for free, which is great. What about being on something like diflucan for Caroline long term? Is that a good idea?
Well, no, nobody really wants to be on drugs long term, and obviously, you know, there can be things to do with the liver and that kind of thing. So it's not ideal, but, you know, if that's what her GP thinks she needs to be on at the moment.
Yeah, I'm actually finished the course of it this week. I was taking one a day for the last few days.
And now that you've finished it, do you feel any different? Has it worked?
It has cleared it,
okay.
But yeah, I still kind of feel generally unwell, so I was just wondering, should even a multivitamin help or something?
Well, probably acidophilus, you know, would help more than a multivitamin. And if you are taking a multivitamin, look for a yeast-free one. You know, there's some kind of brands like Sona that are very good at doing one suitable for people with candida.
And acidophilus will balance your natural your natural body.
Exactly. Yeah. It's bacteria. Yeah. Sometimes when you've got candida, your normal bacteria are very low, and they keep the fungus down in our body.
Okay.
So,
All right, Caroline, thanks very much for getting in
so much.
touch.
Thank you. Bye-bye.
All right, I hope we helped you there. Mary from Kerry, any good over-the-counter medicines for young kids who have coughs? She's tried Benylin and obviously other cough medications, and she says she's been told it's viral, as chest is perfect now, and she's trying Buttercup, that's another cough syrup there, I believe. Any other suggestions?
Yeah, just season, and so this it says that the children have the cough for 3 months. Like 3 months is a long time to have a cough. I just wonder about their immune system. Is it a bit low? You know, maybe they need a vitamin supplement. And it said that she went to her GP. I just wonder what stage did she go to her GP?
Okay.
Like after 3 months, I'd go back to my GP again. You know, 3 months is a long time to have a cough.
It is, okay. Anne and Claire got in touch. I had my thyroid gland removed last July and was fine up until about Christmas, but since then I'm having awful anxiety. She said she's on L-troxane, which is a drug everybody has to take when the thyroid is removed. Could this be affecting my mood?
Yes, your thyroid has a big influence on your mood. So if the levels are too low, you can feel kind of depressed and low and very sluggish and put on weight. But if the levels are too high, you can get anxious. And I wonder when was the last time she went in and had a blood test and had her levels checked, because it just strikes me that maybe it's a bit too high, the amount she's taking. So I think it's worthwhile going back to your GP and getting your levels checked again.
Okay. Geraldine rang in. My 7-year-old granddaughter has lice. They tried a lot of shampoos, but they can't get rid of it. Any advice?
Yeah, I mean, head lice are a big problem these days. Like in Russia, if a child gets head lice, they'll take them out of school, shave their head, and they don't have much of a problem there. There's a lot of resistance, and shampoos aren't as good as the over-the-night preparations. So if you use an over-the-night preparation, some of the newer ones aren't insecticides, and they can dehydrate the eggs and suffocate the lice.
Okay.
But you really need to fine comb. That is the key. You absolutely have to fine comb. There is nothing that is 100%. Everything has resistance.
Back to the old tradition ways. Thank you so much for taking those calls. Unfortunately, we didn't get through all of them. We'll try and get back to them again next time we have our pharmacist on.